All right, here's Jim today telling us about how he used to suffer with dizziness and tinnitus and brain fog and all these things, but it debilitated his life. And it's been a miracle to see his body healing himself. Can you tell us about what you were dealing with before and what we did to help?
I was dealing with brain fog. I had a lot of vertigo, lots of just anxiety. I didn't know where to turn, didn't know where to go to help me get healed. I visited with multiple ENTs. I was diagnosed with Meniers disease. Then I started exploring on my own because I didn't feel like the drugs were the answer. I needed to figure out what the real problem was. And I did go to a naturopathic doctor and I changed my diet, went on a gluten-free, sugar-free diet, which helped immensely, lowered the inflammation in my body, and I did get rid of lots of my chronic attacks that I was having with the Meniers disease.
How long ago was that?
That was 2 years ago.
Cool, that's a huge difference. That's amazing.
Yeah, that really helped a lot. That helped me on my healing path, but I knew I wasn't quite all the way there. And I kept reading and listening to videos, and I heard one about Upper Cervical Care and how that could create a lot of these same issues. So I started exploring that a little bit, ended up here with Dr. Harrison. And it's been a process. I'm not gonna say it was quick. I'm old, so my bones weren't moving that fast, but it took a month before I started really feeling much different. And now I've been visiting for 2.5 to 3 months, and it's really made a significant difference. So I'm now feeling much better. I don't have brain fog anymore. I haven't had a vertigo attack for months, maybe a year, and things are just much better. Feeling quite a bit better.
That's awesome. Can you tell us what was the dizziness doing in your life? Can you give us some stories about how the tinnitus or the brain fog was destroying you?
Brain fog was a daily occurrence. It made it very difficult to get up and go to work. Just motivation. I just felt heavy all the time in my head. Very hard to get motivated to do things. I pushed through it most of the time, but it was very difficult. Created a lot of anxiety and depression, to be honest about that. I just never felt 100%. The vertigo would come in very strong attacks, and that created anxiety because I never knew when they were coming. I would just get like a 10 or 15-minute warning, and then I'd be debilitated. So a couple of times I got stuck out in the middle of the city. I had to pull my car over because it's almost like driving drunk. I had to pull over and call for rescue. I had to be rescued a couple times.
Wow.
A couple times I was out of town and I ended up spending the day in a hotel room. So yeah, it creates anxiety, worrying about that happening, when that could happen. Am I gonna be okay today? Am I gonna just be able to make it home after work? I mean, it's pretty tough.
Well, thanks for sharing that. It's really interesting to know that in his body, when we were able to feel his upper neck, we knew that it was coming from there. And we looked at the x-ray. Remember how the x-ray?
Oh, yeah.
He's got a second bone that's really twisted, and we've had to manually get that over because it felt petrified to the lower segments. But we had to do upper cervical care kind of in a two-pronged approach. We had to come in here where we did some manual therapy, and we had to do a lot of massage to get that spinous of the C2 bone. Let me show you what that looks like in here. So his second bone right here was really twisted off to one side, and all the muscles were really tight, pulling everything over here. So even if we did the alignment with the Atlas, it wouldn't want to stay very well with our nice Atlas orthogonal machine here because there was so much tension in his other muscle tissue. And so we had to work on posture to get this space opening up. We also had to work on massaging and adjusting these lower segments. And then when we would do the Atlas, we'd get really good changes. And we've had a lot of improvement with the x-rays. We'll actually have to show those here, but we really appreciate you sharing your experience with people and how it was a process. He did have to commit to doing several visits so we could actually get somewhere, which is digging him out of this rut that he's been in. And it's amazing to see your body heal yourself. That's really cool.
Thank you.
And I think it takes a lot to understand a patient like him that's compliant with what he's been told to do is why he got better. He went to a nutritionist or a natural doctor.
Yeah.
And they told him to go off sugar and gluten. That's really hard to do. Now, that doesn't come, and when you implement a dietary change, the results